Doctors weren't making mistakes. They were following procedure, and people were dying anyway. In a Vienna hospital in the 1840s, two maternity wards operated under nearly identical conditions, yet one consistently saw far more women die after childbirth. A difference that most staff accepted as unfortunate but unavoidable. Ignaz Semmelweis was one of the few who wasn't willing to accept that answer. While working in the hospital, he began comparing the two wards more carefully, noticing that one was staffed primarily by doctors who moved directly from autopsies to deliveries, while the other was run mostly by midwives who did not. At the time, no one understood bacteria, and disease was explained through vague ideas about air, environment, or the patient's own constitution, which meant there was little reason in anyone's mind to question what doctors did with their hands. Semmelweis focused less on theory and more on outcomes, paying attention to when deaths rose, when they fell, and what changed just before they did. After a colleague died from an infection following an autopsy wound, the connection became harder to ignore. And Semmelweis introduced a simple requirement that doctors wash their hands with a disinfecting solution before examining patients. The result was immediate and difficult to argue with, as death rates in the ward dropped sharply once the routine changed, even though no one could yet explain the mechanism behind it. Despite the improvement, the practice spread slowly, in part because it challenged professional habits and implied that doctors themselves might have been contributing to the problem. Semmelweis kept pushing the same point, not by refining a theory, but by pointing to numbers that refused to move back once the hand-washing stayed in place. Long before bacteria were understood, a simple change in routine had already shown what careful observation and unwillingness to ignore outcomes could accomplish.